Hello everyone and welcome to Net Zero Week, brought to you by YPO and iNetwork. I'm Andy Perrins from YPO and I'll be facilitating today's webinar titled Decarbonisation across health and social care and integrated care systems. The session will focus on a case study from Greater Manchester, focusing on sustainability across an integrated care system. And I'm delighted to be joined by our guest speaker, Claire Igoe, Head of Environmental Sustainability at Manchester University NHS Foundation Trust. Just in terms of housekeeping, as you can see, there's a chat box on the side of the screen where you can submit any questions you might have for the panel. And we will try to answer these at the end of the session. Depending on how many questions there are, we might not have time to answer them all, but we'll follow them up on an email after Net Zero Week. You can also use the menu on the top left of the screen to navigate back to the event agenda where you can see all upcoming webinars. And if you want to register for more webinars, please follow the link at the bottom of your screen. I'll hand over now to Claire and hope you enjoy the presentation.
Thank you, Andy. Thanks for the introduction. So my name's Claire Igoe and I'm Head of Environmental Sustainability at Manchester University Foundation Trust and also co-lead for sustainability for the Greater Manchester Health and Social Care Partnership. I'm going to be talking to you today about delivering a sustainability programme across an integrated care system in Greater Manchester. So setting out the scene for the NHS, the current Chief Executive of the NHS, Sir Simon Stevens, made a statement at the beginning of 2020, which really brought this agenda into focus for the sector. So he said that the NHS is both part of a problem and part of the solution. So actually in delivering healthcare, we also contribute to climate change. So that's why it's important that we mobilise our staff to take action for a greener NHS. And at that point, at the beginning of 2020, he committed to preparing a practical, evidence-based and ambitious route map towards delivering net zero for the NHS. So the NHS position on climate change is that they recognise that it poses a major threat to health as well as to the planet. The environment's changing, that change is accelerating, and that has direct and immediate consequences for patients, public and the NHS. And by tackling it, we can reduce causes of ill health, such as air pollution, heat waves and extreme weather. The NHS in England is responsible for an estimated 4 to 5% of the country's carbon footprint. And with the huge number of staff that are employed within the sector, which is over 1.3 million, there is a big opportunity to make a difference. So the sector is looking to gather together ideas, gather together evidence, save money and eventually go net zero. So the healthcare and public health sector recognises that the environmental agenda provides an incredible opportunity to improve the health and well-being of communities and reduce health inequalities. So lack of physical activity is one example that I've taken here, and that's of great concern for the health and care system. Physical inactivity directly contributes to 1 in 6 deaths in the UK and costs 7.4 billion a year to business and wider society. So things that can be done about that. So ensuring walking and cycling are easy and safe choices for travel will improve air quality. It reduces carbon emissions, but also improves health and well-being from more physical activity. And there's lots of other examples where there's opportunities and co-benefits from addressing the climate agenda, including healthier eating, resilient communities, a greener economy, and most importantly, a reduction in health inequalities. In October 2020, the NHS became the world's first health system to make a net zero declaration and release a plan outlining how it would get there. And that plan has 3 overarching priorities. Firstly, meeting the NHS's carbon net zero targets. So they've set 2. One is for the emissions that are controlled directly, which is known as the NHS carbon footprint. And the target that's been set there is an 80% reduction by 2028 to 2032 and net zero by 2040. And then secondly, for the entire scope of the NHS carbon emissions, an 80% reduction by 2036 to 2039 and net zero by 2045. The second overarching priority is improving health and patient care and reducing health inequalities. And then third priority is building a more resilient healthcare system that understands and is responding to the direct and indirect threats posed by climate change. This pathway to net zero shows how the carbon footprint of the NHS is made up and the range of interventions that will be required to reach net zero. They're broadly grouped under 6 key areas. So you've got in the purple section at the top, these are national and international actions, things that are going to happen anyway with or without intervention from the sector. And in the green section, we've got new models of care and preventative medicine. Then in the light blue section, we've got some interventions around anaesthetics and inhalers, which I'm going to talk about a little bit more later on in the presentation. Then we've got interventions around travel and transport, particularly looking at the fleet, how we deliver goods to NHS sites, but also looking at how staff get to work as well and promoting active travel. Then we've got a range of interventions around the estate and decarbonising the estate. And then finally, medicines, purchasing and supply chain, which is the biggest area. I think it's important to say here that we don't have all the answers yet. So offsetting is mentioned here, but I'm sure that will be further developed over future strategies, and that's certainly not something that the sector is going to be relying on. So what I'm going to talk about with you today is how we developed a sustainability programme across an integrated care system in Greater Manchester. For those of you who aren't sure what an integrated care system is, it's a partnership that brings together providers and commissioners of NHS services across a geographical area to collectively plan health and care services to meet the needs of their local population. So the central aim of an ICS is to integrate care across different organisations and settings, joining up areas like hospital and community-based services, physical and mental health and social care. And across England, there are 42 integrated care systems covering all parts of the country. So the ICS in Greater Manchester is called the Greater Manchester Health and Social Care Partnership. And in Greater Manchester, that covers a population of 2.8 million and 10 separate local authorities, as well as a combined authority. And then in 2014, leaders across Greater Manchester signed their first devolution agreement with government, and a Greater Manchester mayor was subsequently elected and has recently been re-elected. And the healthcare system includes 10 trusts, 10 clinical commissioning groups, and 2,000 primary care settings. The ICS role is really integral to embedding sustainability across the entirety of that healthcare system. So the ICS needs to connect with the combined authority and the local authorities. It needs to set out the challenges and ambitions, embed that agenda into the wider ICS strategic context, and that will also include recovery plans from the COVID-19 pandemic. It needs to engage and collaborate with all relevant stakeholders and different parts of the healthcare system. Needs to consider the local context and drivers. So an ICS in Cornwall will have different needs than an ICS in Manchester, for instance. So it needs to have that local context. The ICS needs to develop, enable and drive the ICS level sustainability programmes and activities and avoid duplication within that programme as well. It needs to take a role in holding organisations within the system accountable for delivery, provide that liaison with regional and national teams, and communicate progress as well. So it's important that where good work is done at both organisation and ICS level, that work is evaluated and widely communicated so that it can be scaled up across other parts of the healthcare system. So to give you some background to the work that we've been doing in Greater Manchester, the sustainability programme started in late 2018 and they appointed a public health consultant to specifically work on this agenda. And I've supported work across the partnership on a part-time basis since then alongside my day job. I've pulled out a few highlights in this presentation, but there is really too much for me to cover in this slot. One of the first activities that we took part in as a partnership was supporting the first Mayor's Green Summit back in March 2019. And we facilitated a number of healthcare themed workshops, as well as making some public pledges of our commitments. That was also the event where Greater Manchester Combined Authority launched their 5-year environment plan. So we established a leadership group following that and launched an interim. In August 2019, we followed the majority of our local authorities in declaring a climate emergency, and then followed that up with an interim green plan in October 2019. And we're currently working on developing the full version over this financial year. The leadership group evolved into an executive leads group, and that is headed up by Sarah Price, who is the Chief Officer for the Integrated Care System. And then in October 2020, that NHS Net Zero report was launched, and that's really given us a clear mandate on the national priorities, as well as a lever to widen engagement across the system. I won't go through this in detail, but I've broadly shown here the delivery framework that we've now established. And it's worth noting that the vast majority of roles are not dedicated to this at all, but they are delivering this work both alongside and integrated into their day job. We've got good representation of leads from across the system represented, and we link into existing groups and governance wherever possible. One of the few new groups that we did establish was an operational leads group, which brings together sustainability managers from providers and CCGs. And we've also made really good use of public health registrars and students for project work as well. Each of the, in England, there are 7 NHS England and Improvement regions, and each of those 7 regions has senior responsible officers for sustainability, and that is typically one from public health and one from the NHS. So in the Northwest, we have 2 senior responsible officers, and since they were appointed last year, that's given us a clear reporting route into the National Greener NHS team. So this is some of the areas of work that we've committed to within the plan and our programme, and I'm just going to pull out a few of those today and talk in a little bit more detail about what we're doing. In relation to decarbonising models of care, we've mostly focused on 2 of the most intensive areas to date, which are inhalers and anaesthesia. Across the NHS, those 2 areas together account for about 5% of the NHS carbon footprint, with medicines overall accounting for 25%. In terms of metered dose inhalers, that's been a big area of focus for us, and the main reason for that is that some inhalers contain propellant gases which have a very high global warming potential, and hence their significant contribution to the NHS carbon footprint. So a Greater Manchester Inhalers Group has been established, and they have set out priorities including significantly increasing the use of dry powder inhalers, recycling used inhalers. It's worth noting that many inhalers actually end up going into domestic waste bins and end up in landfill, and many of those inhalers still have a lot of that gas left in them as well. And then the other area that they're looking at is supporting innovation in the use of low carbon propellants. And then the second area is anaesthetic gases. Again, you've got certain anaesthetic gases that have a very high global warming potential, and other gases which also have a high global warming potential, but we use a lot of them. So there has been a Northwest Green Anaesthesia Network established. There's a lot of work going on at organisation level, particularly in acute trusts. So there's some work right now looking at nitrous oxide reduction. We use a lot of nitrous oxide, and there's a lot we can do there in terms of being more efficient around how we use it, as well as some pilot schemes in terms of capturing that gas at the other end and avoiding it being released into the atmosphere. And then there's also been some work done on changing use of anaesthetic gases. So there's a particular anaesthetic gas called desflurane, which has an extremely high global warming potential, and that's been an area of a focus for many organisations to see how they can drive down and eliminate the use of that particular agent. So sustainable procurement is a significant area in terms of the carbon footprint that contributes to. Prior to the establishment of the sustainability programme in Greater Manchester, we had a Greater Manchester Procurement Board, and there's been a lot of work done through that. And one of the early things that they did was roll out a plastic cutlery switch. We're currently working with an organisation called Advise Inc, and they are looking at all the procurement. Well, they have looked at all the procurement data from across Greater Manchester, and we are going to be doing a piece of work on the top 100 single-use plastic items and applying waste hierarchy principles to that to see where there's opportunities for improvement. And we have in fact rolled that piece of work out across the whole of the North West as well now. Then we've been doing various pilot schemes. So there is some initiatives on laundry cleaning of surgical gowns and all the reusable PPE as well. And then looking at single-use metal instruments, recycling and remanufacture of single-use medical devices. And we've been working collaboratively on both waste contracts and electric vehicles. So that is another key focus. And then moving on to travel and transport, work really closely with our local transport authority, which is Transport for Greater Manchester. We've baselined active travel facilities across our provider trusts in Greater Manchester. So we know exactly what facilities we need, and that helps us in terms of seeking out funding opportunities for that. Been working on fleet transformation as well, looking at exactly what we've got in our fleet and how we can move towards electrifying that fleet. We know that some of the trusts are really well progressed with that, and others are at an earlier stage of that transformation. We've been working with Transport for Greater Manchester on a programme called SUMP Plus, which is looking at the links between transport and health and quantifying some of the benefits with things like community-based and remote care delivery. And then last year, the Greater Manchester Directors of Public Health collaborated and launched an active travel public health manifesto, setting out a wide range of priorities. So the fourth area that I'll just briefly mention is the state's decarbonisation. So we worked with trusts across Greater Manchester in supporting them to develop an energy and carbon baseline and a decarbonisation pathway. And because this coincided with the time that the public sector decarbonisation scheme came out, we also supported with applications to that funding as well. And we have a Director of Estates Lead who is now heading up that area of work. So what we're doing at the moment is we are drawing together all of our plans into an ICS Green Plan, and that's actually something that's been mandated by the national team, that we need to have those in place for the end of March 2022, although they will need to go through some governance outside of that. So the Green Plan needs to include the whole of the healthcare system, apart from things like local authority social care, which would be covered under other plans. It needs to be relatively concise, and that is going to be a challenge, but it does need to be quite high level, setting out ambition and key objectives. We want to focus combine impactful short and medium term wins with longer term focus on benefits to population health and addressing the inequalities agenda. That plan will encompass those greener NHS priorities that I talked about earlier, but it will be wider than that as well. It needs to integrate the plans of the organisations which it's representing, but not duplicate that work. It needs to be place-based because of the sheer sort of scale of the healthcare system and the different parts of the system. It is absolutely a co-produced document. It is not going to be any single person's job to do that. So we're well on with that now, and it'd be interesting to share that further down the line. There's not actually. I think there's maybe only one example that I've seen of an ICS that's actually produced this type of plan so far. So there's not a lot of examples to go out and look at, although there are plenty from other organisations within the healthcare sector. So in terms of just rounding up some of the key learning from delivering this type of programme across a health system, having that senior leadership and named leads for different work areas has been absolutely key. Again, it's never going to be one person's job. It has to be done in partnership. But having that coordinating function has been really, really helpful, because otherwise we've got activity going on. It's not joined up, and you've potentially got some duplication in there. And that's also key in terms of capturing what's happening. We've minimised that creation of new groups networks wherever possible, and just try to leverage what's already there and building on that, unless there's a gap. Data is really key. I've not included that within the presentation today, but I think fully understanding what your baseline is, what the trajectory is, and what those different interventions delivered across the system will deliver. And that won't necessarily be a nice clean subset of what the national programme is. So we're doing some more detailed work on that right now. But what we have found is that, yes, you will see that there's a small number of high carbon emitting organisations, and then you've got other organisations where there's a lot of them, and therefore there's a significant contribution from that part of the sector as well. It's been really important to be clear what the ask is of different stakeholders. We have found that there's been a really receptive audience and getting more receptive over time, and it just really helps when these national messages are coming out as well. And then I think finally, I've just said there, it is complicated and it is challenging, but it's also very rewarding as well. That's it from me. Thank you for listening, and I'm happy to answer any questions.
Cool.
Hi, thanks. Andy Pones here from YPO. Thanks, Claire, for that. That was really interesting. We've now got time for some questions, and we've had some come through now. Claire, if I can read them out, is that all right?
Mm-hmm. Yeah, thank you, Andy.
So first question, what advice would you give to someone who is just starting out on a sustainability programme at an ICS level?
Okay, so I would say that one of the first things that you would want to do is to get some senior management engagement on that. So I'd be looking to that senior leadership team at ICS level and saying who is the lead for this agenda. Then I think I'd want to go and understand what is already in place, because actually a lot of the role of working at ICS level, I guess it's less about having one person who's doing a lot of this, and more about I think more about that kind of coordinating and influencing across the system. So you'll find that there is lots of activity that is already happening that can be drawn into this agenda, and then I think once you know what's already happening, you can understand where the gaps are and what needs to be filled. So I'd say, yeah, it's the senior management engagement, the gap analysis, understand what you're already doing, where there's improvements, and then my next advice would probably just be to break it down and start somewhere, and just don't try and do everything at one go. Just look at maybe look at some easier things to start off with that you can do, and then start moving on to some of the more challenging agendas. Great,
thanks. Next one, how do you go about baselining and setting carbon targets across an ICS?
Another interesting question. I mean, that is a little bit more challenging at ICS level. So I know that the Greener NHS team they've got metrics and analytics teams, so they're doing a lot of work on this. So there is a dashboard available through Greener NHS so that there's a really good place to start there, so you can understand what is already available. I mean, I guess the information that's available will tend to be focused on the providers, and then for commissioning organisations, it will contain information about inhaler prescriptions. So there's quite a lot of gaps in that information. So I'd say look at what's already there. But when you start to look at something like primary care, there's a lot more work to do there. So I'd say look at a proxy measure. So could you do a survey of I don't know, some of your GP practices, for instance, and then you can say, okay, so we've got so many practices, we think a typical practice has this footprint, and then you can start to do that across all the other parts of the sector as well. But I'd say it's an evolving piece of work. The national team are getting better at doing it all the time. So I'd say start with what you can get hold of and where there are proper data sources, and then what you can do is then start to work with organisations within your ICS to improve the quality of that data. So one of the things that, for instance, we've seen in Greater Manchester is that not all of the providers are reporting on their anaesthetic gas emissions, but that there is national data available on that. So it's just getting better. It's improving all the time. But I'd say, yeah, don't worry too much if you can't get everything. Just sort of start somewhere. And then in terms of target setting, to say, sorry, Andy, in terms of target setting, we've got the NHS Net Zero Plan, and then whatever local authority areas that you cover, they will have their own plans as well. So look really closely at those, and then that will help you with setting your targets.
Thanks. Right, next question. Are are there more suitable inhalers and anaesthetic gases? Are the more suitable inhalers and anaesthetic gases more expensive than the higher carbon alternatives? When much of the sector is still focused on saving money, do you have strategies for justifying sustainability over price in procurement and commissioning?
Another interesting question. So with I guess anaesthetics is probably an area that I'd know a little bit more about, and my understanding is that so desflurane, which is the anaesthetic gas with the highest global warming potential, and is the one which we're being encouraged to phase out. My understanding is that that's actually more expensive than some of the other alternatives. So I don't think that there's somebody probably correct me if I'm wrong here, but anyway, that was my understanding from some conversations I've had with anaesthetists. Anyway, in terms of inhalers, I think it's quite a mixed bag. I think there's some inhalers that are cheaper and have a lower carbon footprint, and some that are more expensive. And I think that's where at national level it's really important that we're working with industry on this, because actually the reason why some of these are more expensive might be due to volumes right now, whereas actually if we're all working together and we're prescribing more of these inhalers, then actually the cost will start to come down over time. So I think it's all about a business case, and in some cases of course that's going to be really challenging. But so sometimes we might accept that there might be a small cost pressure in the short term, and that over the longer term that will come down. And then in other cases, I think we need to be working really closely at national level to put pressure on to see what we can do. So if we commit to purchasing certain volumes, does that then bring the cost down? So again, that would be my advice, that we don't all try and do that as individual organisations, but that we really collaborate at ICS, regional and national level. Some of those conversations will be happening. I know that there's National Inhalers Group. There's a inhalers group in Greater Manchester as well, and I'm not involved in that directly, but I know that those conversations are happening.
Okay, thanks. Next one, in the procurement slide, why is there more of a focus on waste than energy when it's usually a small part of the footprint?
So I guess in some ways, so firstly, I'd say it's not all about carbon. So yes, the national agenda in the Greener NHS programme is at the moment very carbon focused, but certainly when we start to look across things like waste management, no, it doesn't provide a high part of the carbon footprint, but we know that there's resource shortages, and actually there are other implications with waste that we need to be thinking about that don't purely translate into carbon. I'd say in terms of this presentation, that's just a snapshot of what we've been doing, and actually some of the things that we've been doing at this stage, because we're still at a fairly early stage in the journey, they are things that have been easier to tackle, and we will of course move into those more challenging areas, and we've got pilots on the horizon for other areas. So I'd say, yeah, there's just a snapshot there. Waste, don't think of it just as carbon. Just we do need to be thinking more in terms of a circular economy approach to the way that we consume and dispose of things within it. We've got this kind of very linear of purchase something, we use it, we dispose of it. So we just can't really carry on like that. So yes. Sometimes it's because it's easier and we've got the opportunities there, and sometimes it's just maybe not a real reflection of all of the entirety of the work that we're doing.
Okay, another one. What do you see as the key role of an ICS in this agenda?
So yeah, interesting. I think the ICS should be there as I think it should be there as an enabler of this type of activity. So I think the ICS should be saying, we understand what the national and the regional focus is here, and our job is actually to enable that within our area. So I think that the ICS is providing that link across the entirety of the health and care system. It's enabling, it's facilitating, and I think that there's an important to focus on what things should sit at ICS level and what things need to sit at organisational level. So I think there's some there's some definite work to be done around that, so that the ICS isn't trying to do and coordinate everything, but they're saying here's the things where actually we can achieve more by working together on this agenda. So here we go. We'll focus on these things and we'll support you with those. We expect you to be doing all of these other things, and that's where the ICS needs to take an oversight role within its patch. So it needs to be, I think, recognising where organisations are doing really, really good work and helping to support that where needed, but also where things aren't happening, then I think that the ICS needs to be taking the oversight there and saying, look, we want to get everybody in our ICS up to this standard, so how can we support you and how can we help you to do that?
Okay, next one. What has your approach been to measuring and reducing supply chain emissions?
Okay, so within Greater Manchester, so as many on the call will know, I think the methodology for measuring supply chain emissions is actually really quite crude and not very accurate. So you would just take spend on a particular area using your E-class data and then say, and then it turns, this is what it means in terms of carbon footprint. So with 3 of the provider organisations within the Greater Manchester ICS, we are trialling a much more in-depth and granular analysis of our carbon footprint. We haven't actually got the output from that yet. It is expected imminently, so we'll be reviewing that and seeing how does that actually translate, and is this something we can apply across the whole of the ICS. So we're doing that in terms of helping to try and improve the methodology that we use. And then on the other side, what we've done is we've been working with a company called Advise Inc., who do procurement analytics for many NHS organisations, and we've actually been collaborating across the Northwest on this piece of work, but we've actually had them process and analyse all of the purchasing data across the Northwest, and we've got the output from that. So what we're focusing on at the moment with that is single-use plastics. It's such a vast amount of data, so we're focusing on single-use plastic items, the majority of which are purchased through NHS supply chain, and then we're going to be doing some supplier engagement off the back of that over this summer. So we're pretty early days on that agenda, but it is something that we've got on our radar, and if we were to pick an area that we should be collaborating on, then I definitely think it's that supplier engagement piece, because it doesn't make sense for us all to try and go out and we're all buying the same stuff on the whole. So we should be collaborating on that and understanding what the suppliers are doing, and if they're not doing enough, then we should be really challenging them to do better.
Great, cheers. Next question. Someone thinks this is a really useful presentation. Thank you. What would you say is the biggest challenge? What would you say is the biggest challenge in working on a sustainability program across an ICS?
I mean, it is challenging. I'm not going to pretend it's not really. So you've got, I think it's the size and the scale of the ICS and the maturity as well. So some ICSs actually, none of them have proper legal status until next April anyway. But actually, some of them have been running in their current status for a while anyway. So you've got some ICSs which are more mature and have staff, and some of them which are really at quite an immature stage. So that's quite a challenge, and I think it's getting the right stakeholders well. You need to get enough senior level stakeholders. You've got to develop those relationships, but that's actually a huge number of individuals that you need to engage when you look across the breadth of this agenda. So the biggest challenge is probably the stakeholder engagement, but certainly from my experience, I'm not seeing a lot of closed doors on this anymore, and I've been working in the environmental sector quite a long time, so I'm quite used to having closed doors, but not so much in the past few years. I think the key would be tailoring your message to the audience, so you won't be able to get everybody at the same time. If you're going to speak to a group of medical directors or a group of senior nursing leads, or you're going to speak to a group of procurement professionals or whatever it might be, or it's directors of estates, you've just got to tailor your message to that audience, and then I think you can develop those stakeholder relationships that you need.
That's great. That's the we've got no more questions coming through there. I've got one, Claire.
Okay.
Obviously, across the ICS, there's a broader agenda across social care as well, and an independent sector out there, all supporting and caring for individuals. How are they involved in some of this agenda? Is that a valid question?
Yeah, of course. So The executive leads group that I mentioned, we do actually have an executive lead for social care on that group. They've not been on the group from its inception, so we do have somebody now. We haven't got as far as so at the moment we're collaborating on a piece of work around return and refurbishment of walking aids. So we're not, I guess, we're not as far advanced with that part of the sector, but we have started including them within our discussions. We've got a lead, we've got some pilots planned, and I think over the next year or so we'll start to I guess get to a stage of maturity with that agenda where we can start engaging with a bit more with the social care. But I guess, you know, some of that social care sector does fall under the responsibility of the local authority, so that would be picked up under their own climate change programmes rather than under the healthcare sector one specifically.
Okay, that's great. Are there any more questions? We've got time for some more. Got until 10:45. If anyone wants to ask any. No. Okay. Thanks very much. I hope that was useful for everyone.
Thank you.
Really appreciate that.
No, that's great. Thank you, and happy for anyone it wants to get in touch that thinks of any questions afterwards or doesn't want to ask them in this forum. That's fine.
Okay. Thank you, everyone. Thanks for watching. Take care.